Hi, my name is Sarah Porter. I'm the Executive Director of Victory Programs. Victory Programs started as a single program on Mass Ave in Boston just over 40 years ago. It was a safe haven for men who were facing addiction at the time. It was a small staff and an even smaller budget. And one day, in an attempt to spruce things up, someone went down to the local hardware store and found a can of paint on the clearance rack. Tomato red. Nobody wanted. So up that paint went on the door, and word spread throughout the neighborhood that if you need help, find the place with the red door. They take everyone. That has remained our guiding principle ever since. When others can't or won't take people in, we do. We were among the first to admit individuals living with HIV into treatment, transgendered individuals into the gender-based programming of their choice, and individuals on psychotropic meds into recovery services. Our red doors have always been open. Thanks to many of you, they remain open and have remained open over the past few months. So your kind words and support, and those of you who have collected helpful items like meals and gloves, those of you who have been incredibly generous with your donations, I have no doubt in my mind that we would not have been able to do what we've done over the past few months if it wasn't for you. So thank you very much. I also want to take a quick moment before we go on to thank our sponsors, our title sponsor, Walgreens, our platinum sponsors of Coldwell Banker, Eastern Bank, and Ernst & Young. All of our sponsors have been unbelievably flexible and supportive during this time, so thank you very much. Since this pandemic started in March, it feels like we've done very little besides think about or plan for or talk about or react to the challenges of COVID. And I have been wildly proud of how Victory Programs, both the staff and the clients, have handled it. Drawing on our history of managing other public health crises, we have put together teams, organized sites, come up with arrangements in order to address everything that comes our way. The individuals that are accessing services at Victory Programs had very complicated lives before this pandemic. With it, you can only imagine. We have a pandemic within an opioid epidemic. We have a public health crisis amidst homelessness, substance use disorder, chronic health conditions, unemployment, stigma, uncertainty, and hopelessness. But the Victory Programs team rallied. Not only did they rally to help individuals keep themselves safe, but to help people keep going, to stay in recovery, to get an apartment, to improve their health, and to hold on to hope. We have vowed to keep this virtual session short. We just want to tell you who we are, what we're doing, how things are going. And because we're very serious when we talk about keeping our red doors open, we are going to ask you to give. Victory Programs has a long history of showing up when things are complicated. I work out of our admin building, which is on Mass Ave in the neighborhood of Newmarket Square in Boston. It's at the intersection. My office is right near the intersection of Massachusetts Avenue and Melnia Cass Boulevard. So a neighborhood that's become known as Mass and Cass. It's also a neighborhood that has a significant number of individuals living outside or staying outside. And that's both during the day and at night. And the vast majority of these individuals are visibly struggling. So the other day, about a week ago, as I was leaving work and I came around the corner and there was a man lying on the sidewalk. Unfortunately, that is not an uncommon situation in our neighborhood. So I came around that corner and I saw there was commotion. Somebody was calling 911, someone was shaking the man's arms, a guy in a very tattered white t-shirt rode by on a blue bike. Somebody was yelling at the man, all in an attempt to change the situation. I started digging in my purse for Narcan, which is the medicine that is used to reverse an opioid overdose. And as I did, another woman came across the street on a blue bike and quick grabbed the Narcan out of my hands. And she dropped down next to the guy, and without missing a beat, she never paused, she never hesitated, she never questioned. She just got involved. It became pretty obvious that we were going to need a second dose of Narcan. And as the woman turned to look around to see what she could do, she looked over my shoulder and saw our sign on the building. And she yelled out, "Victory programs, they'll have something, they'll have another one." And the surge of adrenaline that I was already facing in that moment, or dealing with in that moment, was sort of interrupted by this swell of delight and pride in the fact that she knew us. She knew we would be able to help. We had it. We had the Narcan. We got it. Fast forward, the man lived. He actually stood up and walked away, as did I, as did the guy in the white t-shirt, as did the woman who saved his life that day. It was saving that man's life that day was a team effort. It was an unusual group of first responders, but it worked. And sometimes the best laid plans just need somebody to do it. They just need somebody to walk headfirst into an already complicated situation and figure it out. Victory Programs has had that history for many, many years. And this pandemic has confirmed and affirmed for us that that is still our story. So I want to take a minute to thank the two speakers that you're about to hear from. Both of them did the really hard work of thinking about what they wanted to say, coming up with what part of their story they wanted to share. They wrote it down, and they did the really scary thing of going in front of a camera and having it recorded. The first speaker you're going to hear is named Jeff. He is a staff person at the Boston Living Center, the BLC. And when the Boston Living Center faced an uncertain future, Victory Programs rallied. It's a program that was born out of a different pandemic, that of HIV/AIDS, a program that was built to improve health, fight stigma, to build connections. And when it was in danger, Victory Programs stood by its side. We worked to figure out a solution that not only worked for the program, but for the individuals who so desperately needed it. So please meet Jeff.
Hello, my name is Jeff Webb. I work at Boston Living Center, which is part of Victory Programs as a peer support services specialist. The word peer in my title connotes that I have lived the challenge of being diagnosed with HIV. That was in 1999. I was very much floored when I found out I was HIV positive. I chose denial initially, rather than dealing with the issue at hand. This was a death sentence. At least that was the word on the street. I was fortunate, though, to land at Mass General Hospital and secure a primary care physician who made it clear that this was just a disease. It was not a death sentence. But I still went through a lot of crying, a lot of soul searching, a lot of withdrawal. I withdrew from my family. I withdrew from my friends. I involved myself in drugs, all trying to escape this reality. It didn't take long, though, before I saw that continuing this lifestyle would not be to my betterment. So with some counseling, I began to turn my head around and look for what I could do to save my life. And that brought me to Boston Living Center as a member. At BLC, we don't have clients, we have members. I approached those doors in 2007 seeking support, camaraderie, and education. And that's what I found. One of the staff took me on as a mentee, which was a lifesaver. She was very patient, very kind, and very understanding. She was also the clinical supervisor for one of the educational programs here, which broke down the ABCs of living skillfully with HIV in accessible, useful, scientifically based detail. It was a great course, and I got a lot out of it, so much so that I began to aspire to learn more. So I did, and that was seen. And after a while, my mentor asked me if I would co-facilitate the group. Then in 2010, I was hired as peer support. And in 2012, I was promoted to peer specialist. A lot of people who come through here have nothing. They have no food stamps, no SSI. We help them access those benefits, and I actually love sitting down with the member and doing an online application. But in most cases, really in every case, our work also involves helping members manage the mental aspect of living with HIV. Maybe that's the most important part. Most of our members have experienced profound trauma. Many still do. At the very least, they're dealing with stress and other mental health issues. I've been through it myself, so I can speak to that experience. And that is where the person-to-person aspect comes into play. We embrace people, we engage them. Speaking as peers, we open ourselves up in order to help members share their own lives. The draw for many of our members is the meals program. The great majority tell us that BLC is their primary source of food. That's often what brings them here in the first place. And that's fine. We meet people where they are. Whatever they give me to work with, that's what I'll use. If someone says, I just want to eat something, great, let's go have lunch. We can finish the paperwork later. But what really keeps people coming is the incredible social impact. There's a real need for people who are HIV positive to have a place where they can feel comfortable. BLC is that place, and that's just as important as programming. What we want to do is bring you to the point where you can prepare yourself for what you desire. Go out into the world and ask for what you need. And you know that you have backup, a support system. And that takes talent. That takes commitment. COVID-19 has changed things some. We've had to adapt in a lot of ways. We've been providing meals to go and bags full of food to take home. And now we've reopened congregate meals again, physically distanced, of course. We've started running support groups as well. By the way, we talk about physical distancing at BLC, not social distancing. We've been fighting against another kind of social distancing, the stigma attached to HIV and AIDS since the BLC was founded. The most important thing we can demonstrate to each member is you matter. And it matters to us that you get your life back. That's always been our message. We are here for you. Over and over in this work, there's that critical moment when we first get to really engage with someone or re-engage after an absence. It could be that person that started coming through our door just for the meals. That might go on for weeks, but then there's that day when they turn to you and say, can you maybe help me with something? Or it could be a member who we haven't seen lately because it's been difficult to come in with all the disruption that the pandemic has caused in their lives. And then there are people who have moved on, people we haven't seen for a year or 20 years, but something's happened and they thought of us. Because a BLC, once a member, always a member. And there's simply no place like this. I say that from my personal perspective as a member and a staff person. And when that moment comes, I always say the same thing. It's good to see you again. Now, what can I do for you?
Thank you, Jeff. That was very beautiful. I completely agree with what Jeff says, that these solutions can be incredibly complicated. It's never a case of just getting a job or just having a meal. It's always this intricate, overlaid, sometimes interlaid, very overwhelming map or web of solutions. And very often it takes another person, an external person, someone from a place like Victory Programs, to come alongside you and help you knit that map back together. So please meet Misty, who is a graduate of the Victory Programs.
Hello, my name is Misty. I'm a grateful recovering addict, a mother, a survivor, and also a Victory Programs graduate. I grew up in a small town south of Worcester. I played sports, I was in student council, and I got good grades. Once my father passed away, that changed, and I eventually dropped out. After that, I met my soulmate, TJ. We shared 7 years together and had 2 daughters, but he passed away when I was 21. I then had a son with someone else, but that relationship didn't work out. Shortly thereafter, I began a relationship with a man who seemed to be good for my kids and for me, but things went south when we both started drinking as a result of his daughter passing away. The relationship grew toxic and abusive, so I left with my kids. TJ's parents took my daughters in so I could get back on my feet. I was homeless and couch surfing with my son in Worcester. One day, my mother called to ask if she could take my son for the weekend. I assumed things would go as usual, but after what my son had told her about our living conditions, she chose to place him in the custody of the Department of Children and Families. This crushed me, but it was the catalyst that began my road to recovery. I was so lost, so broken, and unsure of what the future held, but I fought for my children until I could fight for myself. That's what kept me going. After my son's removal, I chose to numb the pain by drinking and using. My drug of choice was opioid pills. I'd had some medical issues prior to this when I was given painkillers, yet no warning of how addictive they were. I wound up using them to cope. Back then, my hangout spot was the Worcester Commons. One morning, I saw my friend Butch on my way back from the liquor store. I looked up to Butch like a big brother. He treated me with dignity and respect, despite my condition. When he saw me, he said, "Misty, what are you doing here?" "Oh, nothing, just chilling." "No, what are you doing here? Look around. You don't belong here. Please go get some help and get out of here." I'll never forget those words or the way he said them. I do believe God sent Butch my way when I needed to hear that most. I went to the hospital where they did an assessment. Because I advocated for myself, they got me a bed at detox. I'd never been to detox or treatment, but something had to change. I stayed for 30 days and chose to go on to further treatment at Victory Program's Jolene's family home on Long Island in Quincy. Some of you may remember the Long Island Bridge incident. Let's just say I had bad timing. Exactly 1 month after arriving, the bridge collapsed. The staff at Jolene's were great, and I was beginning to really settle in, and then, boom, the bridge gave way. Over the next few months, I was sent to various programs until I was finally able to get a bed at Victory Program's Shepherd House in Dorchester. Thank God. Miss Angela was the program director, and she and Miss Zanelli ran a tight ship. For an addict like me, who was used to living life on her own terms, adjusting to rules took some getting used to. But I knew it was for my own good. I really wanted to get as much out of the program as I could. So I complied, even when it was difficult. I participated in each group that they held and engaged in the community. They knew I meant business. I eventually started getting weekend passes and was able to visit my kids more. I was working full-time to save money to get into a sober house, and after 4.5 months, I graduated and moved on to one in Fields Corner. My next goal was to work to get into a place where I could have all of my children back with me, to get custody of my son, then to bring back my daughters. Regularly attending Narcotics Anonymous meetings and therapy played a large role in building a firm foundation for my future. And DCF was finally allowing me to have overnight visits. It felt good to value myself again, to have integrity and hold myself to a higher standard. Now I want to make this clear. All of these things were instilled in me at Victory Programs. Everything there was meant to help me grow as a person. The guidance I received there stuck with me well after I became an alumna, and I'm forever grateful for that experience. My court date arrived to get full custody of my son. The judge called me up and said, "I remember you. I must say that you've made my job easy. You've had full compliance the entire time and even took it upon yourself to sign up for extra classes outside of DCF's recommendations. I see no reason why not to reunite you with your son. I know you will do great things." While all of what she said was true, it wasn't until that moment that I believed it. I was taken aback. It was so surreal that after struggling for so long, my hard work paid off. I was really proud of myself. My daughters decided to stay with their grandparents until they both finished high school, but it felt like no time for that day to arrive, and we were all under one roof again. There's been work to do in the way of earning their trust back and strengthening our relationships, but that work, it pales in comparison to what life was like without them. They have their mom back. I'm currently working full-time, and I'm studying at Roxbury Community College to work in a field one day, helping other people. I want to fulfill the promise I made to my father, which was to never give up on my dreams. I know, without a shadow of a doubt, that I'm wiser and stronger after all I've endured. It is entirely possible to create the future that I deserve. I have a lot of people and places to thank for that, but Victory Programs is at the top of that list. There's a powerful stigma attached to addiction. We all know that. What you may not know, but what I believe, is that every addict carries around that same stigma somewhere inside them. It's a big part of what makes it so difficult to move forward. That internalized stigma started to fade away from me at Victory Programs. I allowed myself to begin healing, and I started to see that what happened to me did not define who I am, and I moved forward. Today, I am doing great things. Thank you.
Wow. I am really lucky that I get to spend a big part of my life surrounded by people like Misty. People who have a depth of strength that most of us will never know. And still, every time I hear a story like Misty's or Misty's story, I find myself a little shaken. And it's about the hard work and the slow, painful, fragile road to recovery. It's about the joy of reunification and the gratitude around having someone, having a partner, having a place like Victory Programs there to walk through that together. I'm always also struck by the outstanding pain of those who are still struggling to connect. So part of my job as the executive director of Victory Programs is to make sure we have the money that we need in order to do the work that both Jeff and Misty talked about. So like so many other things, COVID has completely flipped that upside down. Our costs are up, our revenue is unpredictable, and the needs are absolutely higher than ever. So staffing, professional cleaning services, cleaning supplies, food, tech, you name it, the costs are all up. Costs are up. Government funding is unpredictable, insecure, unreliable at this particular point in time. Individual giving is also a little bit unpredictable, lost jobs, shaky economy. But we have no doubt that we are going to see more people turn to Victory Programs for help. So that being said, please give whatever you can. Any amount you can give absolutely will help us in keeping our doors open. You can go to vpi.org and give that way. Victory Programs has done, since this pandemic began, we were very committed from early on to balancing the needs of staff with the needs of clients. Those accessing services with those receiving services, those accessing services with those providing services. Clients and staff, all with an eye towards safety to the best that we possibly can. Our staff, like healthcare workers, are considered essential. Many of them put their lives at risk every day, be it working on the street with the mobile prevention team or in emergency shelters or recovery homes. People are very much on the front lines. Those staff who could work from home did so. We equipped them with the very expensive tech that they needed to be able to do that. Also, along those lines, many of the services that our clients access became virtual. Healthcare services, family visits, external support groups, all of that went virtual at the time. In order to ensure that our clients would remain successful, we quickly equipped all of our programs, all of our buildings with the tech needed so that they could continue to access what they needed and do what they needed to do. How did all that work? Well, it wasn't bad. We kept our infection rates down. We helped people keep safe, stay safe. We managed all of our own positive cases, those people who were positive, both staff and clients. We did what we needed to do, that those people were safe, they were cared for, and they had what they needed to recover. We're learning from our past lessons, and we're moving forward, preparing for whatever comes this fall. The other side of that equation is that all of our in-person fundraising events have canceled because of COVID for this calendar year. Who knows what's going to happen next year? Those dollars raised from those private events count for about a third of our private revenue every year. So all of that combined, high costs, lost revenue, people in need, more coming, we need your support and are asking you to give. Go to vpi.org. It'll be incredibly obvious when you get there how to give. I'm going to take just a couple minutes to give you some really tangible examples of what your gift or how your donation will support us. So we right now have 2 women about to give birth in 2 of our programs. So not only do we love babies at Victory Programs, but we're very well aware that the stress that comes along with giving birth and having a newborn, and that can be a very unstable time for women. We want to do everything we can to set these moms and these babies up for long-term success. Therefore, if you do the math, average infant uses about 320 diapers a month. Unless there's some sort of really good sale going on, that comes down to about $250 a month, just for those 2 babies for 1 month. So if you give $250, you are covering the costs of those 2 newborns and their mothers for that month. $125 covers about 50 to-go meals at the Boston Living Center. You heard Jeff talk about these. We are still giving these out in addition to groceries. The food insecurity that Jeff talked about was before COVID. Again, people's lives were really difficult ahead of time. With this, it's even more complicated. $75 will fill the gas tank of the mobile prevention team van. That van is at street level every day, getting things like Narcan, life-saving equipment into the hands of those that need it most. $50 will help stock the pantries in our programs. You can imagine how many cans of beans and how many cans of soup $50 can buy. That being said, assuming you are like others during this shelter-in-place time, I'm assuming you've perfected your snack game. I had a program director tell me very early on that he had eaten his way through his quarantine snacks within the first weekend. So the clients in our programs are just like the rest of us. They are experiencing the stress and the anxiety of not only this pandemic, but the world in general. So we 100% understand that balanced, nutritious food is not a cookie in each hand, but cookies are very helpful sometimes. So with your $50, we will not only buy the good, solid, nutritious beans and soup, but a handful of cookies in there as well. So please give what you can. Again, it's at vpi.org. It'll be obvious once you get there. Every dollar you give will help us keep our doors open. Thank you for joining us. Thank you for caring about what we do, for caring about the people we work with, and for helping to keep our red doors open.